Hey guys, it's Andy Huang here. How do we tell a good egg from a bad egg? I like to use visuals, okay? And the visual I used in the past was my bucket of balls, okay? So here I have, my egg analogy. And as you recall, when we talked about eggs, every woman has a mix of good eggs and bad eggs. And here we're gonna use the red balls as good eggs and we're gonna use the blue balls as bad eggs. How do we tell if it's a red ball or a blue ball? Okay, there are two ways. The first way is what we always hope as fertility specialists, and that is that we're able to help a couple achieve a pregnancy very naturally, or with a little bit of assistance. So if it's a male factor, we'll do insemination. If it's an ovulation disorder, we'll try easy ways to achieve a pregnancy. But when you're achieving that pregnancy, it's like being blindfolded, and you get to reach into the bucket and you get to pick out a ball. If it's a blue ball, one of the bad eggs, usually you don't get pregnant, okay? Sometimes you will get pregnant and you miscarry. The most difficult is when you do get pregnant and you don't miscarry and you find out later on there's Downs or Turner's or some chromosomal abnormality. So there's two ways to find out if it's red or blue. The first way is when you get pregnant naturally. And as soon as you get pregnant naturally, you're gonna call our office and we're gonna monitor you and we're gonna watch your pregnancy. And there are milestones that we see at 5, 6, 7, 8, 9 weeks. At about 10 weeks of pregnancy, there are abilities where we can do a blood test on a woman and check for fetal DNA. And that fetal DNA test will help us discriminate between healthy pregnancy, one that originated from the red ball, or sometimes, unfortunately, we find out that that pregnancy has one too many chromosomes. We can also do amniocentesis, CVS testing, and those are, again, more definitive ways to tell if it's red or blue. Only other way to tell if it's red or blue is when we do IVF. And when we do IVF, in vitro fertilization, essentially we're taking this bucket of balls, okay, and we're pouring it on the table. And when we pour it on the table, we're able to harvest 10, 15, 20 eggs sometimes. And now for the first time we get to see the eggs. But it's almost like we're colorblind. And we can't tell the difference between a red ball and a blue ball and a red ball when we look under the microscope because they look the same. A healthy egg and an unhealthy egg are gonna both look like this here, okay? So here's an oocyte, and we can't tell if it's red or blue, okay? A good egg and a bad egg, they both look the same, okay? So how do we know if it's red or blue? When we start to put it with sperm. Because as soon as we put it with sperm, we're gonna find out the next day which ones fertilize, okay? And some of the blue balls are not gonna fertilize. And we're gonna watch these embryos now grow and divide. And they're gonna go from 2 to 4 to 8. And you've heard me kind of talk about how embryos develop in our laboratory. And ideally, for every 10 eggs, we're gonna find out that maybe 2/3 fertilize. For those 2/3 that fertilize, remember, nature's gonna weed out some of the blue balls, okay? We're now down to 7 for 10. And from those 7, we're gonna watch them divide and grow until hopefully they get to a stage where they have about 100 cells. Now from those 7, we're down to 4. And these are your 4 best embryos. And from these 4, we're hoping that one of these is a red ball. If we're lucky, maybe 2, even for women who are older. If we get the good fortune of finding the healthy egg that creates the healthy embryo, and we test the embryos and we confirm that the 46 chromosomes are there, we can achieve really good chances of getting pregnant.